Hello, everyone. I am Dr. Syed M Quadri, US board certified psychiatrist. I've been working in this field over 20 years, and today we're going to explore every major aspect of OCD in depth. So stay tuned to the end. We'll talk about some new treatment options. Imagine if a thought coming back into your mind, one you desperately wanted to get rid of, but the more you try to stop it, the stronger it came back. That's what OCD feels like, a mental trap, where your own mind overwhelms you with fear and exhaustion. It's not just washing hands or checking locks repeatedly, it's about constant doubt, fear in every decision, and the exhausting need to make everything perfect. OCD, Obsessive-Compulsive Disorder, is a mental health condition where a person experiences recurring, unwanted thoughts they can't control. These thoughts create intense anxiety or distress. And to ease that anxiety, the person starts like repeating certain behaviors like excessive hand washing, counting, repeatedly checking things. It can begin at any age, but most commonly starts during childhood, teenage years, or early adulthood. Research shows that OCD sometimes typically appear around the age of 19 or 20 years of age, but 25% of males may show signs as early as age 10 years old. So according to the National Institute of Mental Health, or NIMH, OCD affects 1 to 3% of people worldwide. That might seem like a small percentage, but in its actual numbers, that's more than 70 to 210 million people globally. In the United States alone, over 3 million adults have experienced OCD at some point in their lives. In India, the National Mental Health Survey NMHS reported that in 2016, OCD prevalence was 0.6%, but current estimates suggest a rise to 2 to 3.3%, which is significantly given India's large population. That's around 2.8 to 4.6 million people currently struggling with OCD. Study shows that OCD is slightly more common in females. Women are 1.6 times more likely to develop it. However, in adolescence, the condition is seen more commonly in males, almost 2 times higher than in girls. If you want to dive deeper, I've shared all the research links in the description box below. Feel free to check them out. So when we talk about the symptoms of OCD, we need to understand that OCD is made up of 2 components, obsession and compulsion. Obsessions are intrusive, repetitive thoughts that cause distress, and compulsions are repetitive behaviors or mental acts performed to reduce that stress. Let's take a closer look at both one by one. Let's begin by talking about obsessions. These are intrusive thoughts that enter the mind repeatedly and cause intense stress or anxiety. The person tries to suppress or ignore them, but they can't control them. I've seen patients told me multiple times how they're just so struggling, they can't get rid of those thoughts. Let me give you an example. Someone with the fear of contamination or infection. Perfect example. Feeling like everything is dirty or infected. Constantly thinking you need to wash your hands or change clothes. Another one would be a fear of causing harm, the irrational fear that you might hurt yourself or someone else, even when you have no intention or doing so. It's so disturbing to them. They feel so stressed out from it that they're going to hurt somebody. They isolate themselves because of that. Another example is the intrusive and disturbing thoughts. These are unwanted thoughts that keep popping into your head, like sudden disturbing mental images or imagining something terrible happening out of nowhere. There's one patient of mine who told me that she's keep on thinking of her ex-boyfriend getting in her mind for no reason, even though she had broken up that relationship a long time ago. She's currently involved in a good relationship with somebody, but then she just can't let go of that old boyfriend in her mind picture. Now let's talk about compulsion. When someone repeats a behavior over and over again to escape the distress caused by the obsession, it's called a compulsion. Let's look at some examples. So excessive hand washing is a very good example that I've seen in many of my patients. Washing hands repeatedly out of fear of germs or contamination, even if the skin becomes damaged. I've seen patients, their skin has become so dry and they developed so much, and they had to like use a lot of hand lotion. And the other one I've seen is also constant checking things like door locks or the stove again and again, even if they're like already secure. I've seen patients, it takes them an hour or two to leave the house because they're constantly checking the locks or checking the oven, they're checking things. It takes an over 2 hours for them to leave the house because of this constant rechecking and checking behaviors. Another good one is counting and repeating behaviors. Repeating actions until it feels like just right, like counting to a certain number or repeating words or steps. I mean, I've seen some people, they get stuck on counting like up to 5 or 10 before they do something. Or they just have to, if they touch one part of the face, they have to touch the other face. It's that they have to repeat. They can't just, or they get stuck on even numbers or odd numbers. So if anything ends in odd, they'll have to make it even because they get stuck. So these are some of the common symptoms I observe in people with OCD, but there are many other symptoms that may occur too. Let me know if you want me to write, we could do a separate videos on that complete symptoms of OCD. Now let's explore what causes OCD and the risk factors that may increase the likelihood of developing it, right? Let's break it down to step by step. The first one, obviously, the genetic factors, right? If someone in your family, like a parent or sibling, has OCD, you may have a higher chance of developing it too. Research suggests that OCD can have a genetic component, meaning the disorder can run in families. Second is your brain chemistry and neurobiology. OCD is closely linked to a brain chemical called serotonin. If serotonin levels are out of balance, the brain struggles to process information properly, which can trigger OCD. Certain brain areas like the frontal lobe and the striatum are also involved. And if these areas are not functioning normally, symptoms may worsen. Third, environmental triggers. OCD can also be triggered by traumatic or stressful like experiences, especially during childhood, like emotional abuse, family conflict, loss of loved one, or intense pressure. Such experiences can lead the brain to obsess over certain thoughts, eventually turning into compulsive behaviors. There may be also be other contributing factors that increase the likelihood of OCD. Have you or someone you know ever faced symptoms like these? Tell us in the comment below. Now that we have covered the causes and the risk factors, let's go deeper into the symptoms to understand them better. Professionally, there are several assessments used to diagnose OCD. But one of the most common tools that doctors and psychiatrists use to understand OCD and plan the right treatment is the Yale-Brown Obsessive-Compulsive Scale, which is also known as YBOC, BOCS. This is a specialized test that measures how severe a person's obsession, unwanted thoughts, and compulsions, repetitive behaviors are. These tests helps determine whether the patient needs therapy, medication, or a combination of both. Doctors use the YBOCS, or like I said, known as Yale-Brown Obsessive-Compulsive Scale, along with differential diagnosis to accurately assess OCD, so they can decide the most effective treatment approach. If the right treatment is provided at the right time, OCD can be managed and life can return to normal. So when OCD worsens, it can seriously impact daily life, work, and relationships. But with the right treatment, it can be brought under control. So treatment can vary from person to person, which is why consulting a doctor is essential. So one of the form of treatment is therapy. So exposure and response prevention therapy is highly effective where the person is gradually exposed to their anxiety triggers, but without the performing any compulsive behaviors like hand washing or checking things. Over time, the brain learns that it can handle anxiety without rituals. According to research, ERP or exposure and response prevention therapy can significantly reduce OCD symptoms. Where I've seen patients who were afraid of being in dark room, I've seen where they have taken these patients, like they would so sit in the room for maybe a 10-second, 1 second in a dark room. Ultimately, they get exposed to it over time. They're able to sit in the dark room alone without having any fears. This is different types of exposure therapies depending on what the needs are. I've seen my patients that had really helped them. Another big options that we use are medications. Doctors may suggest certain medications to help reduce OCD symptoms, which work by balancing serotonin levels in the brain. But these medications should only be taken under medical supervision because everyone's body reacts differently. And the other one is a deep brain stimulation, DBS. When OCD reaches a very severe stage and neither therapy nor medication is effective, DBS may be used in rare cases. This involves sending electrical signals to specific areas of the brain to improve symptoms. However, it is only considered when all other treatments have failed. One major novel treatment that's been it's been FDA approved is transcranial magnetic stimulation. TMS also has shown to treat OCD symptoms. In my practice, I've used TMS and I've seen patients gotten better with their OCD symptoms. And we talked about TMS in a different video. You can look into there too. Remember this: treatment for OCD varies from person to person, so always consult a doctor for the most appropriate treatment. OCD isn't just a habit, okay? It's a mental maze where the mind can trap itself. But the good news is, with the right treatment, therapy, and awareness, it can be controlled. If you or someone you love is struggling with OCD, don't wait. Seek help, because life is far more beautiful without a repeat button. If you found this information helpful, please share it. Your one share could change someone's life. So tell us your thoughts in the comments, and if you want to watch more videos like this, don't forget to like, subscribe, and hit the bell icon. See you in the next video. Thank you for watching.